You're listening to the Doc Lounge podcast. This is a place for candid conversations with healthcare industry's top physicians, executives, and thought leaders. This podcast is made possible by Pacific Companies, your trusted advisor in physician recruitment. I am your host, Summer Gilbert, and I am the Director of Marketing and Branding here at Pacific Companies. And my co-host today is Pacific Companies Director of Physician Recruitment, Casey Galpin. And just a quick reminder, this podcast is intended to be an open forum. Any personal beliefs, views, or opinions represented in this episode are that of our guest and do not necessarily reflect the opinions of Pacific Companies. So please have an open mind and remember that this podcast is not a news source, but rather a safe and neutral platform for candid conversations. And that being said, today on the podcast, we have Dr. Craig Louisy. Dr. Louisy is a board-certified general surgeon practicing in Washington, D.C. at the moment. But he was born in the West Indies on St. Lucia Island. So he has a really interesting and unique story, and we are really fortunate to have him here today. So Dr. Louisy, thank you so much for being here and spending your precious time talking with us today.
Thank you for having me.
Of course, it's our pleasure.
Yeah, what we like to do in the beginning is just, if you want to kind of give us a quick 30-second, a minute background about yourself. Where did you grow up? Where did you do your medical school residency? Just a quick overview of things like that.
Sure. So I actually grew up outside the country. My mom is from New York. My dad is from an island called St. Lucia, and I spent much of my childhood there before coming back to the States, and basically going to college at Howard University, Washington, D.C. After that, I ended up going to medical school at Temple University in Philadelphia, and I liked DC so much I came back, went to Washington Hospital Center to do my surgery residency. Following that, I did a year of fellowship in bariatric surgery and minimally invasive surgery. And from that point on, I wanted to kind of explore options in other parts of the country. I wanted to see what other surgeons were doing. So I thought embarking on a locums kind of track would be ideal. So after doing a year of employed work with a hospital in Maryland, I decided to venture out and do some locums. So I've been to places like Maui, Oahu, South Dakota, North Carolina. Those are just a few of the ones I've been to. So, and then again, I circled back to DC. So, I am back in the DC, Maryland, Virginia area, which is where, I reside today.
Very interesting. So how does a guy that grew up a lot on the islands be up in the Northeast with the weather, the snow, the rain? You'd think that a guy from that spent a lot of time in the islands would want to be down in the warm climates.
Well, yeah, you can't take the island out of the boy. So I am still that tropical kind of kid. I obviously prefer warmer climates to cold weather. So, I do still tend to migrate when I can, work permitting. I would kind of go somewhere tropical just to recharge. I do still have family in St. Lucia, so it's very convenient for me to just go down there if I wanted to. So
is it the professional opportunity, or the family, or just the city you like, DC, of what keeps you up there? And the reason I ask that question is we talk to physicians all the time that are trying to make a decision on which job do I take? The one with a great professional opportunity, but it might not be in the best weather for what I prefer, or do I take the money? How are you kind of making that decision to stay up there? Is it the professional opportunity that keeps you there, or?
I think it's just because Washington D.C. was really the first place I set foot on when I sort of started my education, and so I grew accustomed and I grew in love with the D.C. area, and obviously traveling to other cities, I liked aspects of those cities as well, but I always felt like Washington D.C. being the capital, it had this rich history. Plus, it didn't have these like skyscrapers all over the place, like, no disrespect to New York or other big cities, but you could see the sky, and I think maybe that's what it was. I liked to be able to see the sky, and there's some green spaces, and, it was a mix of different things, and the diversity in DC, which I enjoyed too. So it had a lot of different things that I liked. And, not to mention, I did have family who had been to DC for school before. So, there's a little bit of, some roots there as well. So, all of that combined, I think, made me, like the area.
Gotcha. So out of the places you travel to locums wise, what would you say is, the place that you were unexpectedly really enjoyed?
Oh, that's a good question. North Carolina, maybe. 'Cause in North Carolina, I worked in a very small community hospital in a very small town outside of, Fayetteville. And I'd never been in a small town before. I'd been on a small island, but I'd never been in a small town. So, it's different, right? So the demographics are different. The culture is a little bit different. So I went in with a little bit of trepidation, but then I realized, which is what I wanted to get out of locums, which is that enrichment about, looking at how people handle situations, how they interact with each other. And, I came to the conclusion that, they're just very nice people down there, and everybody just, it's a small town, if you can imagine, like a small town in America where everybody kind of knows everyone and they look out for each other. They're very, they're grounded in their faith and all of that stuff, and, they're taking their kids to soccer and all these things. It's just very, interesting kind of dynamic down there. And the physicians were, I felt, highly respected because, when you get sick, where else are you going to go? You have to rely on the one surgeon, for instance, in that case, me, who's the surgeon for that area. And so I think it's the way I imagined surgery to be, in that the reciprocity between physician and patient, the politeness, the civility, just the pleasantries of, say thank you, and, and I'm feeling good that I was able to make a difference in someone's life so they can go back to work in the hardware store, or they could go back to, work in the nursery or whatever. So it's nice. It's a good feeling. So that was a big surprise for me.
Do you think maybe later on in your career or you would ever want to go practice rural medicine?
I don't think I would. I don't think it's my style, if you will. As much as I loved that chunk of time that I spent there and that part of my life, I find that, again, like I said, I tend to gravitate towards the urban kind of life. So I always circled back to Washington, D.C. So even when I was in North Carolina, in the back of my mind, I always said, I kind of miss the hustle and bustle of the city. I miss having a restaurant open at midnight that I can just, on a whim, just like go and eat something. I miss interacting with friends, so that's what I like about city life, a more vibrant way of life.
Sure. So, Doug, I want to pivot back just a little bit. So, you, in your last year of medical school, you're finishing that. You have one of 23 or 24 residencies you can choose from. How do you choose general surgery, and what made you choose to get into that as your career?
I decided on general surgery in my third year of medical school after doing a rotation out in, I think it was out in rural Pennsylvania. And I fell in love with just the hospital. Again, it was a small town, so therein lies that theme again. But what I enjoyed about surgery was almost the instant gratification from it, right? You have the reward of making someone feel better than they did before you laid your hands on them and before you kind of, removed whatever ailment or disease that they had. And you just feel like, okay, I've done something productive, and they can now go on and function normally, or to the best of their ability because of an intervention that I did. So I find that to be more satisfying than no disrespect to my internal medicine colleagues, but I do find that being hands-on is more. It's a much more tangible gratification than, dispensing medication, although that in itself is helpful. But for me, I preferred hands-on kind of work.
Yeah, to not just diagnose the condition, but to be able to treat it and fix it, solve it.
Treat it and fix it, exactly.
Gotcha. Okay, so then you do a bariatrics fellowship. So and I'm sure this was a little bit of a challenging decision. You're finishing your last year of residency, so you've already got 10, 12 years in education and training. You can stop right there. The money you're going to make is going to be a little more than you're making in residency if you would go into practice. How do you hold off on that, do one more year of fellowship to do bariatrics?
Well, yeah, so it's kind of an evolution, as many doctors can probably attest to it. During, your mindset's different from day one as an intern compared to, year 5 or 6 or whatever as a resident, chief resident. I decided midway in my residency that the way in which surgery was going, it seemed to be more, at that time, this was around 2003, 2004, minimally invasive surgery was already popular, but it was becoming more popular, and it was becoming the go-to way to operate. And I was just fascinated by the technicality, the hands-on thing, the using smaller instruments to get out, to extract an organ. I found that to be so fascinating. So I sort of tailored my training towards that. So as I approached the end of my residency, I decided, I need to apply to a minimally invasive surgery fellowship to kind of hone in on some of those skills. And that's why I ended up doing, at the time, it was still kind of fuzzy how they would describe these fellowships. They were not strictly minimally invasive surgery fellowships, at least all of them. Some of them were minimally invasive surgery / bariatric surgery. And I preferred the minimally invasive part, but I went ahead and did the bariatric, which was part of it, because we do the bariatric surgery as a minimally invasive approach anyway. So I figured I would learn techniques either way.
If you could go back, would you still pick general surgery, or would you choose another specialty?
I think I would probably pick general surgery, but I would approach it with a different mindset than I did when I just started. I had a different expectation when I just started. So now that I've been through it and I know exactly, the ins and outs of it, I would probably approach it differently. Still doing general surgery.
In what way?
I think developing a more regimented approach to work-life balance, I think I would have probably utilized that a little bit more. I think going into surgery, sometimes we have a tendency to, at least I can only speak for myself, I guess, diving head first into it and not really taking the totality of the situation as far as balancing your work and life. And so it can be detrimental if you allow the work to kind of consume you as you go along.
Okay, so would that be, I guess, being a little bit more precise on the job that you take, or looking into that more, or how would you go about it, or how would you recommend to, somebody coming out of general surgery residency to not fall into the same situation that you did? What would you recommend to them? What advice would you give them on what to look for?
So I would probably say, and it probably all goes back to the type of person you are, the personality that you have. Mm-hmm. So for me, I think I'm more confident now than I was back then. Mm-hmm. I'm more able to set boundaries now than I was back then. And I think for anyone going into surgery, it's important early on to kind of politely set boundaries as you go along, so that you don't overwork yourself. That's one of the big things for me. Just thinking, don't do. I've heard other colleagues, but based on what they've told me, don't do surgery because someone suggested it to you. Obviously, do it because deep down, you feel like this is what you want to do. Don't do it. Don't let a desire for fame or prestige or even money be that driving force for choosing your specialty. So those are kind of some of the pearls that I would, relay on to others.
Do you think there's a certain type of personality or person to go into general surgery? I think, in my opinion, I think just having this is going to sound very cheesy, very cliche, but I think just having a caring heart is one of the big things. Okay, it's not about the way surgeons have been stereotyped as far as like having this expressionless kind of gun-ho, I'm going to throw the scalpel across the room because I'm a surgeon kind of thing. It's more about having the compassion for your patients, and I think that's what's kind of gotten me through the years, is that I feed off of the patient's kind of what's the word I'm looking for here? Well, I feed off of their moods and how they are so grateful for what's been done, that it kind of propels you to just continue doing what's right for them. And that's really the personality that I've had for me. But I've worked with many surgeons. Just like anybody else in any other profession, you're going to have different personalities. I don't think there's just one personality that should define someone for being a surgeon. I've met the happy surgeons, the angry ones, the really selfish ones, the really giving ones, technically good, not so technically good. At the end of the day, it's really all about if the patient really had a good outcome and if they're happy with what you've done for them. Yeah. How do you manage your work-life balance?
It can be challenging at times, and but as I had mentioned before, I think I went full throttle when I first started, which is very customary for any trainee coming out. They they want to do their best and show up and do the work. That's all well and good, but I think you can't get too lost or too consumed by that. You have to remember behind, all of that, there is still a human being, i.e. you, who has to be taken care of. And if you're not careful, you can spiral into like sleep deprivation, malnutrition, that's a bit harsh to say malnutrition, but basically poor nutritional choices, things like that can chip away at you as time goes on. And luckily for me, I kind of listened to my body, so to speak, years ago. And I said, just slow down. You can't treat everybody. You got to take care of yourself. I think that's so important, and I think that's not really emphasized as much in training. We're all about, this is what we're going to do. We're going to be good to patients, and we're going to take out their gallbladders or fix their hernias. Yeah, but what about the surgeon? You really have to, we're the ones doing the work, but we have to also focus on our well-being. So that's one of the biggest things for me. And right now, I can say to accomplish those things, I do, again, I don't want to sound like I'm some guru, but like I do meditate sometimes to kind of just in preparation for surgeries. Like prior to surgery, I do sort of a visual representations in my head before doing surgery. It's very calming. I take deep breaths. I do all of these things, and also for as far as the physical aspect of it is concerned, I stretch. You have to do a lot of sort of physical therapy in a way, before and after surgery, because if you don't, you can end up having problems with your neck and your back, and so all these things. It's all about taking care of yourself,
Yeah, it's interesting. As a recruiter, the number one reason why physicians contact us and say, "Man, I'm looking for a change," is because of work-life balance and quality of life. They say, "I've made the money. I'm tired. I want to spend time with my family. I want to enjoy my time. Like I spent all this time to perfect my craft. I want to enjoy life now." So it's interesting that you say the same thing, because we hear it all day, every day from physicians we talk to.
It's absolutely true. I mean, it's pervasive. I mean, I have surgery colleagues who tell me, I'm so, I really have to take time out from my family. I've been working so hard. It's really wearing me down. I've heard all of those things. So yeah, I totally identify with that.
Yeah. So I want to get your thoughts on this. We've done a lot of these podcasts, talked to a lot of physicians, and when it comes to choosing your profession, residency, fellowship, the number one thing they say to do is do it because you have a passion for it, because you love that aspect of medicine. And likewise, they say, don't choose a specialty because of the money. Would you agree with those, or what would you say the biggest do and don't of choosing, your future career?
Well, I completely agree with what you just stated. I think doing a job that you from the outset don't feel like is for you is kind of ridiculous. I think a lot of times we're almost thrusted into professions by whether it be your family influence or expectation of what society might think of you, or what you think you're going to get out of it monetarily. That's really not those are really not good reasons to go into it, especially given the amount of work that is involved, because at some point you're gonna reach a area where you say, okay, I'm not really liking this at all, And then what are you going to do at that point? You know, it's, you've wasted years, doing something you didn't like to do. And it's just, you're filled with regret and resentment and all that stuff. So yeah, I would say do it because you really, really want to do it. And there are people out there, I mean, not to dissuade anyone, but there are people out there who, and I've worked with people, they're just extremely passionate about what they do. And you can tell it's emanating from them. And, you know, and then there are others who you can tell they're just doing as a day-to-day job. They just really have no passion. It's just, you know, it's night and day for, you know, looking at these two types of surgeons.
Yeah, passion is one of the things you just can't fake it. You either have it or you don't, and it's so evident in any aspect of life.
Exactly.
So, Doc, one of the central themes of our podcast, it's a lot of it is focused on, you know, residents, fellows, new grads. So, if you kind of being, you know, looking retrospectively, what do you wish that you would have known in residency that you know now? Or what would you have changed about, you know, residency or going into it or coming out of it now that you have, you know, the decade or so of experience?
So many stories, so many things. But as most students would probably know, surgery residency is no joke. It can be very rigorous, and it really also can. Adding a layer to that, it depends on who's your chief resident and who are the people above you that are looking out for you. One of the things I think I would love for trainees and residents to do is seek a mentor when they're in training. I think that's probably one of the biggest regrets that I have, is feeling like I was swimming out there by myself at times, you know, and not having that surgeon that you can just go to for anything. I think you get lost in the crowd when you're in a residency program. And I think if perhaps you had one surgeon who was kind of assigned to one resident who they can confide in and things like that, it would enrich that experience for the residents.
That's great advice. That makes total sense. We're almost out of time, but I want to make sure I slip in this question because it's one of my favorites. So in your 13 or so years of practicing, what is one of the most interesting or craziest cases that you've come across?
I would have to say it is putting an emergency airway or endotracheal tube through someone's trachea because a pit bull had bitten their neck during a barbecue. And Whoa. They came in through I was in one of these rural hospitals at the time, and as a general surgeon, you're pretty much the surgeon for everything. So you see everything. So I was called down to the emergency room because this guy had been bitten by a pit bull. I said, "Oh, it's just a bite, dog bite. What's the big deal?" You know, and I get down there and he's like breathing out of his neck, like the air is bubbling out of his neck with blood and everything. But, we had to kind of emergently stick a tube. I had to emergently stick a tube through the hole in the neck to allow him to breathe. So that was pretty cool.
He was critical.
Yeah. I mean, he was gonna lose his airway, so we had to do something very quickly.
Wow.
Being a rural hospital, we stabilized him and then helicoptered him to the nearest trauma hospital. But yeah, that was exciting.
So when you see something like that, it comes in, like, what's your initial reaction to something like that? Like, I was like, what goes through your mind when you see something that obscure? Well, inside you go, oh my God, right? But outside you have to be,
you have to be sort of like the captain of the ship, so to speak, and you have to display a level of calm and, sort of just be smart about how you're approaching things so that no one else thinks you don't know what you're doing. And you kind of get hoisted up by your knowledge of the anatomy, because once you see it, you kind of say, okay, it's the neck. I've operated on the neck before. I know the anatomy. I know the implications of having a hole, a tear in the trachea. I know what to look for. So your instincts kick in, your knowledge kicks in. It's just getting over that initial, like, oh my gosh, and then kind of you get into the zone and you kind of just do what you're supposed to do. But yeah, it's exhilarating. The question you asked, it is kind of just a rush. It's a controlled rush, put it that way. You have to know how to tame it, and so that you can focus on what you're doing, and then talk about it when it's done. When the patient's all better, you're like, oh my God, look what happened.
I gotta imagine the adrenaline, kind of dump afterwards. It would take you a while to get back up after that, because you got to just be at the peak of your adrenaline when that comes in, and obviously you calm down to do the procedure, but that's got to be intense.
Yeah, it is intense, and I think the adrenaline, a lot of it is from, oh my God, I don't want this person to die on me. I'm the only person here who's really, in that particular case, I was the only person who could do what needed to be done. Oh my God, the pressure's on me to do this. And so that will straighten you up really quickly, because you're like, okay, it's all falling on me to do this right. And this patient is relying on me to do this properly. And I really want to do it properly for them. And, a lot of emotions kind of can run through your brain at lightning speed. But at the same time, your hands have to be working. You have to keep, going and doing what you have to do, and not get distracted by those thoughts.
Do you feel like you have pretty good autonomy?
I do. I think I do. Yes.
Yeah, that's good. I mean, especially we've heard a lot of physicians say when they're in more of a rural setting that they feel like their autonomy is greater.
I think when I'm in more of a rural setting, because number one, you're the only surgeon that's there, and everybody's looking up to you, and the patients are relying on you. It's almost like it gives you a little bit of leeway to say, okay, I'm going to do, I don't know how to describe it, but you just feel like you're not being overseen as much by everybody at your level, all of your other peers. So you have to focus on doing what you want to do and not deal with other people staring. I don't know how to best to describe that, but yeah, it's a different dynamic when you're in a rural setting.
Yeah. Are you still working locum tenens?
Yes, I am currently.
Yeah?
I was previously in an employed position, and then because I guess as the theme goes for this entire talk, I'm still kind of circling around Washington D.C. looking for that an ideal permanent job close enough to where I live.
Gotcha.
So right now, yes, I am doing locums.
Okay, so you're looking into getting into something more permanent then.
Something, I guess permanent is a bit too specific. Something that's more stable, if you will. So if it were a locums position that was an ongoing locums position and it was close to home, I wouldn't be opposed to that.
Yeah.
So yeah, either one.
So, kind of random topic, but for physicians out there that have never done locums, you have a pretty good amount of experience with it. What would you just say to them as far as if they're considering dipping their toe into that avenue?
I would say it's definitely worth doing. For me, I did it only a year out after training. I would probably recommend people do it maybe a couple years out from their training. Maybe work, an employed position for a little bit, get their rhythm going, figure out what it is they're capable of doing, their strengths and their weaknesses, and then go and do locums in different parts of the country or the world or wherever, because you have that confidence going out there. I kind of did it differently in that I did it when I was fairly fresh out of training, and I think it was deliberate on my part. I wanted to just throw myself in there to be shocked and to figure out how I'm going to do things and improvise and, learn in that kind of environment. And it worked for me. And I learned a lot from different surgeons everywhere I went, or other healthcare professionals. But yeah, I think locums is a good thing for people to do. You learn about yourself more than anything else, really, as a surgeon.
So what would you recommend them to watch out for or to look out for if they're considering a locums assignment? Anything that, in your experience, to really keep an eye out for?
I've not been asked that question before. Let me. I would say, if you're, I don't know if I have anything to say about that. I can't think of anything at the moment.
Unfortunately, I think we're pretty much at our time cap.
Sure. Okay.
I really appreciate you taking your time out of your day. I know it's right in the middle of your workday, so this was fascinating. I really, really enjoyed the conversations.
I think it's great what you're doing, because I would have loved to have this when I was in training. This would be a huge resource for me. So it's good what you guys are doing.
Oh, thank you. We like hearing that, because it makes us more excited and pumped up to keep talking to more physicians. So, Well, thank you. And what's your plan for the rest of the day?
I actually have a pretty short day, so I'm just going to run some errands.
Cool. Nice.
So,
all right. Well, it was so good to get to know you, and we'll hopefully maybe have you back for part 2.
Okay.
All right.
Thank
Have
you.
a good day.
All right. You too. Bye.
Take care. Bye.
Thank you to all our listeners. If you'd like to be notified when new episodes air, make sure to hit that subscribe button. And thank you to Pacific Companies. Without you guys, this podcast would not be possible. If you'd like to be a guest or for more information, go to www.pacificcompanies.com.